Thank you so much, Chelsea, and thanks to everyone that joins us this afternoon or morning, depending on where you're coming in from. We are so excited here to be able to provide information about mobilizing an emergency preparedness response for agricultural workers. As Chelsea mentioned, my name is Gladys Carrillo. I am the Director of Program Services. And we also have a guest featured speaker, Candy Alvarez, which I'll be introducing here shortly. Today's learning objectives are the following. You see them on the screen, but we really do want you to take away information about the importance of emergency preparedness planning and any strategies that you may be able to incorporate into your own planning efforts when you work with vulnerable populations like agricultural workers. We also hope to provide different resources and ways for you to be able to identify and develop partnerships with organizations that can be part of your response efforts. So a little bit about NCFH. For those who might not be familiar with our organization, we are a national training and technical assistance provider, a nonprofit located in Buda, Texas, and our mission is to improve the health of farm worker families. And we do this through a number of different services. We have different workforce and population health training and technical assistance, research and data collection, outreach services and support, governance and board leadership training, as well as health program development and resource tools. A critical part of our efforts is the Agricultural Worker Access Campaign, which was launched in 2015 as a joint effort by NCFH and the National Association of Community Health Centers, or NAC. We thought that we knew that more could be done to increase access to quality health care for America's agricultural workers, and the result was this Ag Worker Access Campaign. Our increased access to care program has resulted from this initiative and is a major focus of the current trainings that we provide. We hope that you will be able to join the campaign and continue to contribute to the goal of reaching over 2 million agricultural workers served by health centers across the country. So this slide just depicts the progress that we've had of the campaign over the years. And as you can see, we've continued to work towards our 2 million goal. We obviously always have room for improvement. So we're counting on you to help us continue to be able to reach those agricultural workers and continue to move these numbers forward in terms of the patient populations that you guys are providing services to at your organizations. So NCFH really has done quite a bit in terms of emergency preparedness. And this list here describes a little bit of our efforts in terms of what we've done so far. I'll be providing an overview of different resources that we have developed at the end of Candy's presentation. But I wanted to share that we've actually done quite a bit of different webinars and trainings like the one today, and have facilitated a learning collaborative where different health centers have come together to talk about ways to plan for emergencies. And this actually was started when COVID hit in 2020. You know, obviously COVID impacted all of us, including health centers and the way that they provided services. So NCFH really responded to the need, and we're able to create this space for different health centers to come together with organizations so that they can improve their emergency response efforts. And Candy was actually one of the participants of these learning collaboratives. So we're very excited to have her here to be able to share the strategies that she has for you guys and to be able to incorporate some of these strategies into your own efforts. So Candy has been with the Health Center for Emergency Partners for 10 years, and she currently serves as the Emergency Preparedness and Response Coordinator. Among a multitude of courses in disaster and emergency preparedness, she has completed the Emergency Management Specialist Certificate from the California Governor's Office of Emergency Services, the California Specialized Training Institute, as well as the Infrastructure for Disaster Management Certificate from Texas A&M Engineering Extension Service. Candy co-chairs the EPRF Drills and Communications Subcommittee, where she helps design exercises for our members to test emergency response and alternate communication methods utilizing principles from the Homeland and Security Exercise and Evaluation Program. She also represents HCP and its members at healthcare coalitions in our countries of service. So I'll pass it over to Candy.
Thank you, Gladys. So good afternoon, everyone. My name is Candy Alvarez. Yes, I'm the Emergency Preparedness Coordinator at Health Center Partners of Southern California. And today I will be presenting on facilitating an emergency response for that farm worker population. So a little bit about the organization I am with. Health Center Partners of Southern California is a consortium. We have 16 primary healthcare organizations, and collectively they serve 190 combined practice sites. So that does include medical, dental, the school-based, behavioral health, those pay centers for the focus on the elderly, among many more other types of facilities. We are located throughout Southern California across 3 counties. So that's San Diego, Riverside, and Imperial. And as you can see here on the map, we do border with Mexico. We serve as a catalyst for transforming and enhancing the primary care. What we do is we help our members, we help them deliver that quality healthcare to the safety net population. We provide innovative programs, resources, and advocacy. And we have proudly been serving our community health centers for 46 years. Okay. Next slide. So our program, Emergency Preparedness and Response Program. So it's myself and 2 other peers. We assist our members in their preparation, response, to local disasters, public health emergencies, through either direct support and representation at the state, local, tribal, and territorial levels. So we represent them in the Medical Health Disaster Coalitions. We are also a member of the California Primary Care Association for their emergency management peer network. We also are a member in the San Diego Hospital Preparedness Program. A lot of the trainings that we use come from the principles and the guidance as outlined in HCEP, or the Homeland Security Exercise and Evaluation Program. And also we conduct assessments in accordance with that CMS survey and certification group for emergency preparedness. Slide. So a little bit about me. Thank you, Gladys. She did go over. I've been with Health Center Partners for 10 years, and I serve as the Emergency Preparedness and Response Program Coordinator. And also at the bottom, you'll see these are the programs, the program activities. So we give guidance in disaster preparedness. We help in coordinating the coordinator onboarding, like when your health centers have someone that takes on that role, either that's their primary role or maybe it's their secondary role. So sometimes they need a little help and guidance in onboarding on what they need to do, especially if you're under the CMS guidance. And of course, the CMS emergency preparedness rule, we give training and support on the 4 pillars. And then we have peer networks and work groups. So we meet regularly with our members. Every month we meet and we go over issues. We talk about trainings, best practices, so we can all be prepared together. And then we have a mini training series where we go over 30 to 60 minutes, because we know that in the health center environment, time is so valuable. And for preparedness activities, 30 to 60 minutes, if we can just get that really, really helps in preparedness. And then, of course, we have safety and security assessments. And then we do the Stop the Bleed for that bleeding control training. Okay, next slide. Okay, so why do we plan? Why disaster and emergency planning? So first off, to be safe. You need to be prepared and ensure your own safety, and then the safety and readiness of your family and loved ones. That is the priority. That is the most important thing. And then you need to be mission ready for your community and your organization. So if you're prepared, if your family's prepared, then you will feel better coming into work or staying at work. You play an instrumental role in making sure that your health center organization is ready for any crisis by having those solid preparedness and response plans. And it's very important that you have already assessed those risks and then you plan appropriately. Now you need to examine your hazards and how they're going to affect your facilities, people, property, infrastructure, and the environment, because of course we all want to keep our doors open. And then the plans you create establish those policies and procedures that'll help in your response and communication. And this also helps with keeping those health centers in compliance for CMS, or for some of us, perhaps the Joint Commission. And by planning collaboratively, your organization will be better prepared and more resilient. Slide. Okay, so I'm not going to go over this very thoroughly, but this is very important for many of us who are under the CMS emergency preparedness final rule. You know, for us, everything we do is to make sure that our health centers are, in compliance with those 4 pillars. So the purpose is to establish national emergency preparedness requirement to ensure adequate planning for both natural and man-made disasters, and very importantly, to be in coordination with the federal, state, tribal, regional, and local emergency preparedness systems. So now this final rule does apply. There's 17 provider and supplier types. For us, I did put here, so we have the PACE centers, that's all-inclusive care for the elderly. We have our rural health clinics, and then we have the FQHCs. And each provider and supplier will have its own set of emergency preparedness regulations incorporated into its set of conditions or requirements for certification. So you must be in compliance in order to participate in the Medicare or Medicaid program. Okay, next slide. So here is just the breakdown. And when you get these slides, you'll be able to go straight to the CMS website and go through this more thoroughly, but I just quickly put on here the 4 core elements. So your risk assessment and emergency planning, and that's going to include your hazards, your communication plan, your policies and procedures, and of course, training and testing. Okay, and you can actually use this slide when you get it as a checklist. Okay. Natural and man-made disaster threats we face. So here I just put images because this affects probably all of us. Weather-related, the wildfires for us in Southern California. Unfortunately, we do have quite a bit of wildfires. We're always training for those. The power shutoffs, civil unrest. That's nationwide. There could be civil unrest. Cybersecurity threats. When they get a hold of that patient information, you have to train for that as well. Of course, the H1N1 and COVID. And then right down here, I have active shooter or active assailant. And of course, the earthquakes, floods, and hurricanes. So next slide. Okay, but today's focus is on farms, farm workers. So farms are high-risk workplaces. And I just want to take a step back and let you know that as we go through these slides, there will be a lot of content, a lot of text, but I'm not going to go through every single thing. But I want you to be able to take these slides and you can turn them into checklists, because at the end of the day, when you leave, I want you to just take something to prepare for you. Just be prepared. Okay, so let's move on. So farms are high-risk workplaces. Here I've listed some of the hazards that you can find on the farm. Animal-acquired infections and related hazards, grain bins and silos, hazardous equipment and machinery, heat, ladders and falls, musculoskeletal injuries, noise, pesticides and other chemicals, respiratory distress, unsanitary conditions, the vehicle hazards, and of course, we have our youth in agriculture. So these farm workers are exposed to numerous safety, health, environmental, biological, and respiratory hazards. So the farm workforce is aging. They're also disadvantaged because of their disadvantaged access to medical services, and they're more likely to work alone. Many of these injuries are underreported or unreported, so that makes it challenging to accurately measure farm-related incidents. Workers aged over 55 years old, they account for a majority of all work-related incidents, and were significantly more likely to die than younger farmers. So living on these farms, now you have these unique relationships between the home and the workplace. You're starting to have multiple generations. They may also live together on the farm. They've started to settle. This can have benefits, but it can also present risks to health, well-being, and safety, as we'll see in another slide regarding COVID. And children and older farmers are at high risk of those fatalities and injuries. And unfortunately, some farmers can become accustomed to a lot of these hazards and risks, and so they stop actively looking for ways to reduce those risks. Slide. Okay, so let's take a pause, and I'm going to pose a scenario for discussion so that you can just think about it, take a step back and just think about it. So here's an image of a fire at a farm. And I just made clear to put on there that this is not agricultural burning, because I know that does happen, but this is a fire at a farm. Okay, so it's 8:15 in the morning and you have just settled in at work, and it happens to be the community health center that is less than 20 minutes from the nearest farm, or for those who are on here, wherever your organization is. So you're less than 20 minutes from the nearest farm. And now you're starting to hear from your coworkers, and you're seeing reports on social media and the news that there's a large fire that is reported from that farm. Okay, so you have to validate this information, but let's just say for now that it is a fire. So 30 minutes later, okay, it's almost 9 o'clock in the morning, the foreman from the farm arrives with a van carrying 12 people, and they all have respiratory issues. And then he tells you, well, there's more vans coming. There's more people coming. Not only do they have respiratory issues, but they have people with minor burns. So if you could please just put in the chat what you think you would do. Number one, what is the first thing you are going to do in your current role? You know, as emergency manager, you know, you may have a leadership role, you may be the foreman, whatever it is. Please put that in the chat. And then also the second question that I pose is, if you are a health center, are you prepared to take a surge of patients? And now think about it, many of these patients probably may be part of the underserved populations, and they are new patients. And then while also treating these patients, while treating the patients that you already have scheduled, they could be in the lobby, you know, they're ready to be seen. And now you have a van that just arrived with 12 new people, and you know that more are coming. And then where are they going to wait? So that's another thing you have to think about. So thank you. I see there's some responses in the chat. Chelsea, do you see anything else?
I don't. I see a response from Brian. It looks like he put notification of a mass casualty incident. And Ron commented as well, contact EMS first thing. We are not staffed or equipped for emergency medicine. Then try and triage until EMS arrives.
No, that's great. Yeah, and you have to think about those things, because these populations really look to the community health centers almost like a sanctuary. You know, they look to us as a place, a safe place where they can go for not only care, but for other types of services. You know, I know a lot of us may have outreach programs. They know that this is a trusted source. They're comfortable coming to these health centers. So they are probably going to come to you before they go to the hospitals. That's a big possibility, especially if a hospital is far and they do not have the transportation to get there. Okay, so thank you. Thank you for answering that. Yes, thank you, Joe. Okay, so next slide. Thank you. So In emergency management, we should all be planning for what we call the whole community, and that includes the farm worker population. So in order to plan, you need to understand who they are, where they live, and where they gather, besides knowing where they work. So this is going to help when you decide what activities, training, outreach programs, you're going to build your communications plan, and also very importantly, about disseminating the information about how to be prepared for these disasters, threats, and emergencies. So understanding who they are and where they live and where they gather, that is going to be very important in how you plan. And so I just put a stat here. I read by the National Center for Farm Worker Health. There are 2.9 million agricultural workers in the United States, and a majority, or about 70%, are foreign born. More than half are born in Mexico, and the majority reported they are most comfortable communicating in Spanish. And about 97% are Latino and 92% are Spanish speakers, with 44% that do not speak English, or perhaps they speak another dialect from Mexico. Language is going to be especially a barrier for those indigenous farm workers. So these workers, they are a key link in the food supply chain nationwide. They are so important to our agricultural economy. And as the years have gone on, these farm workers have become settled. They are now a settled workforce, and they are aging, with the average worker over 40 years old. So now the consequence of settling is now they're living with their families. Okay, and so instead of keeping their families in their countries of origin, they are living with their spouses and their children. This is important because when you're preparing, you're not just preparing for you think one farm worker. Now you know that they're going to have their families and their children and spouses. So that will lead to women's care, maybe pediatrics, whatever it is. But now you know that it's not just, one farm worker. They come with their families. Farm workers are mostly male. And like I said, in the US, this means women's health concerns, prenatal care, and pediatric services that come with their families, and all these necessary needs. So connecting these farm workers to a clinic as a regular source of care is very helpful, very necessary. But even small changes in their worksite location is going to raise challenges to that consistent care, since many of them carpool and they don't have access to private transportation. Also, those contract workers, they could be sent to different counties regularly. So this is going to create an unsettled day-to-day work life. So although the discussion of farm workers aging and settling presents these changes as a source of vulnerability, the presence of family is also a strength. So family members, and this is very important for when you're trying to disseminate information, family members, they can help promote health, and they can also help promote preparedness. Okay, one barrier to understanding health information is lower education. So involving the farm workers' children and spouses in medical visits and treatment plans does increase their health literacy by making this process collaborative. And again, this is where you can really start putting out for outreach programs and planning to give out all that information, include that information in different languages. So even though you may not be able to get to the farms, to the farm workers, you can leverage the family members, when they come in for their visits. Okay, next slide. So lessons learned from COVID. So these farm workers, they continue to work during that emergency. Okay, while many of us were able to shelter in place at home for all those months, these farm workers were living in crowded conditions because they had to survive economically. So it was making it difficult. They couldn't remain socially distant from other household members. All of us, we switched to working at home during the pandemic, but they're essential, and they continued to work in the farms. Even as it says here, numerous studies detailed the farm workers' fears of catching the coronavirus at work, compounded by lack of access to healthcare and social services, but they still needed to work to survive. So these public health efforts or deployed a family-based approach during the pandemic. So by disseminating all that information from about vaccinations, all this went through all those family channels. So it's more culturally appropriate than sending them through social media campaigns. Trusted nonprofit and educational groups, including legal services organizations, schools, and migrant education programs. Those can play vital roles in sharing public health information. Those vaccine clinics that inoculate the farm workers and their family members, those can control the spread through the farm worker communities more effectively than this focusing just on the workers. And although emergency Medi-Cal covered the COVID-19 treatment, regardless of immigration status, long COVID and resulting disability still threatens the farm workers' health and livelihoods. Slide. So now we're going to shift and talk about how important it is. You need to plan for your personal emergency preparedness at home and at work. So you can have, it's one thing to have 3 days, or 72 hours or a week's worth of supplies for your employees, but it's another thing if they can't make it there. Okay, you can't keep your doors open. You have to encourage your employees to be prepared on their own, or they're just not going to show up to work, okay? Because they're going to want to leave, they're going to want to stay home with their families, especially if the schools close as well. And so very briefly, we have the 4 steps to being prepared. 1, become informed. 2, you make a plan, build a kit, and then practice and training. Okay, very briefly, so become informed. So for all of us, at home, if now we're a remote working environment, or if we're still working at a facility or a site, start with becoming informed by the hazards around you. Okay, safety is necessary when experiencing all hazards, whether this means sheltering or evacuating. That's always going to depend on the specific emergency. So understand what hazards threaten your community. Learn about the response plans, the evacuation plans, and designated emergency shelters. Okay, and then become familiar with the emergency procedures for your child. Talk to the schools and see what is their procedure. If they had to be evacuated, where would they go? Because in the time of a disaster and a crisis, you don't want to be worried about where is my child, because you already know what the school's plan is. Okay, and then those community warning systems. Here I just have a couple examples. So of course you have your radio stations, but there are apps such as Shake Alert, and that's for earthquakes, and that could give you from 1 to 10 seconds before an earthquake. You can feel it, and that's just enough time to either hide under your desk or get out. And also watch duty. Now that's for wildfires, and that's really, really good for situational awareness, because at least you can see where are the fires, how close is it to me, and it even shows you like where is the wind blowing, and that's really good. So you can kind of figure out like what do you want to do? How close is this fire? Should we leave? Should we close doors, or should we just stay and watch what's happening? So all of that is really good for situational awareness. And then, of course, look to your county level programs. Okay, so the next step is make a plan. So figure out who's going to do what, either at home or at work. Okay, what are the roles and responsibilities? Do you know your company's emergency operations plan? And do you know your role? And especially for CMS. So if CMS was to come in and create an audit, one of the first things that they might do is ask the emergency manager to leave, and then they're going to ask a staff member, tell me the top 5 hazards. Tell me, what would you do? Okay, so that does come up on audits. Okay, so where are you going to go to reunite? What are those rallying points at work? So when you do those fire drills, you hopefully your staff members already know where are they going to go, where is the rallying point, and how to check in with their supervisor or that pre-designated person. And then always have those plans. So we use this methodology called PACE, especially when it comes to communications, but it can be applied really to anything. So you have your primary plan, alternate, your contingency, and then your emergencies. And then the children. Who are going to get the children? Talk to them about what to do in a disaster or an emergency. Okay, and of course, we all have our other dependents, our extended family members, our neighbors, especially those elderly neighbors who may not be able to, help themselves. Like, for example, if there's a wildfire and they get a knock on the door, if they're in a wheelchair, like, they might not be able to evacuate. So if you're aware of who your neighbors are, that would be very helpful as well. And then, of course, for many of us, our pets are part of our family. So have those plans for your pets, because in a disaster, it is possible that you will be separated for those pets. Okay, and already have the numbers of like hotels that do take pets. Okay, because if you do have to get evacuated and you have to go to a hotel, and you have your small animal with you, or your dog or cat or whatever, make sure you know which hotels will allow you to go in. And then this is very important, your communications plan, probably one of the most important things you need to have a very strong plan for. Your phones, your cell phones, texting, and internet. So those can and have all failed, especially during whatever it's a power shutoff, wildfires that can take down those power lines, hurricanes, tornadoes, flooding. So now you're going to have to think about those secondary plans. And also, how are you going to update your employees? So do you have a reverse 911 number they can call in? How about if they need to know, are we supposed to come in the next day? What do we do? So they're going to want to know information. Yes, they may be able to contact their site supervisor or manager, but it would be good if there was a line, maybe you have an EOC already set up where they can call and they can get those updates. And of course, the contact cards for your family members. Okay, and now number 3, so building a kit. Okay, so creating a kit at work, at home, or in your car, this is going to have to self-sustain you for up to 72 hours, if not longer. So you're going to probably have to shelter in place or evacuate. So have personal kits, and yes, include them in your car at your workplace and have it ready to go. And then create those bags for your pet, your children, and other family members. So make individual bags. Here I've listed out some considerations and recommended items. I'm not going to go through them thoroughly, but you can see you can actually use this almost like an additional checklist. These are just additional stuff, like shoes, for example. If you're going to work and you have some nice shoes on and there's an emergency and you have to evacuate, you're going to want comfortable shoes to be in. Okay, a solar charging bank. Because what if your cell phone dies? You're going to need that additional solar charging bank. That's going to help. And then, of course, a tourniquet. So that is for bleeding control, and that could save a life. Okay. And then here on the other side, I have some other basic items. So ready.gov/kits. That is a great resource for checklists on making a kit. And then you can see towards the bottom, ready.gov also is in Spanish. I believe I have the webpage on our resources page. And then lastly, practice and train. So training your employees is a very cost-effective and valuable way to test those policies and procedures. And remember to practice on the items that you're not too familiar with. And of course, test your smoke detectors, have those updated contact information, and then practice your evacuation plan. Also, make sure you know the important phone numbers that you call. But if they're only saved in your cell phones, maybe you don't know the numbers by heart. So know those numbers. Okay, so now let's move on into organizational preparedness. Okay, so you have to be ready. You move on. Next slide. Okay, so these disasters can take many forms, and the financial cost of rebuilding is overwhelming. So if you do not have a continuity of operations plan, or what we call a COOP, if your organization is prepared, you're going to be in a much better position to recover and continue operations. Okay, so I've broken this down into 3 parts. Your hazard and vulnerability analysis, I believe we probably all do that. We probably even have to submit that to our counties, or but just know do the hazard and vulnerability analysis, and that will lead into creating a plan, and then you're going to execute your plan and practice. Okay, and then next slide, I'm going to have more detail on it. Okay, so here's an example of what an emergency and operations plan looks like. And so I did take part of this from FEMA, but of course you customize it to your health center, whatever type of organization you are. So I've broken it down. It does have different pieces. So you have your basic plan, and that's going to have, purpose, overview, concept, organization, assignment of responsibilities, and the trainings and exercises. And then it's going to be broken down by your appendix. And so this focuses on all those critical operational functions. Okay, and then next slide, please. And then here I've just broken it down. So what does it look like? So this may be in the back of your plan, but really have it listed out. Communication plan, continuity of operations, evacuation, shelter in place, and so on. And then hazard specific appendices. And this may be where you want to put something for the farm worker population, or whatever you want, but have it in your plan. Okay, and the plan doesn't have to be a certain number of pages. Some plans are like 200 pages and some are 60. I've seen them both ways. And then use simple language, simple terminology, because this is going to be going through your leadership. They're going to be reviewing it. Everybody has to understand it. Okay, next slide. Okay, so I'm going to take a little more time on this because this is a really important example of a disaster response. So this really happened back in January. So I sat down with Golden Valley Health Centers. They were kind enough to sit with me and let me know how they responded to such a huge disaster. So they serve 3 counties in California's Central Valley. They have 45 health centers, and that includes 4 school-based health centers, 2 freestanding women's health centers, 12 dental clinics, and 2 homeless healthcare programs. So in January of this year, a small Central Valley community of Planada, California, was hit by back-to-back storms. So there was a creek that ran past the town and it broke through an aging levee. So this prompted evacuation orders for the predominantly Latino farm worker community. This resulted in 90% of the houses being affected. 90%. Can you just imagine how overwhelming that is? The floodwaters swamped the town and all the surrounding agricultural fields. So some of the families were able to go to a temporary shelter setup, and that was a county-run housing project. But many others had to sleep in trailers parked in their backyard, half disassembled homes with torn out carpet, and so on. Many of those families didn't have flood insurance, let alone personal savings to cover the cost of repairs. So they had to either wait to move back in, find a new place, or in many cases, they had to relocate. And if you live in California, you know that the housing crisis, it's very hard to find a home. So the schools were also closed because of all the damage. So these farm workers, they lost weeks or months of wages as one storm after another inundated the planted fields. Thousands of acres of farmland was inundated, and there was virtually no work for weeks. So their lifetime of hard work building their homes were damaged or completely destroyed in the floods. So just think about how mentally catastrophic that is, that you just lost your home and now you can't work for months. Okay. And then even before the flood, many in the town, so they had all these issues, asthma, bronchitis, other respiratory problems. And all of this was exacerbated by the pollution from the pesticides and the nearby dairy farms. So in the aftermath, the mold and the rot that was left over triggered even more allergies and respiratory issues. So many do say that this flood was either a natural or climate disaster, but others say that the flood was preventable. So those creeks and canals were not properly maintained. And some may say that perhaps the county failed to identify flood risk for the communities. And in turn, this failed to protect them from the damage brought on by the storms. Okay, so it's laying out what happened. Now, Golden Valley Health Centers, this was their response. So they have a medical clinic in Planada. but they were committed to helping their residents, and they mobilized a quick response. Okay, they didn't just think about their patients and their staff, but the whole community that they served. Like I said, they were a place that the community could go to, that they trusted. They were resilient. And then they reopened in less than 6 months later, even though they were one of the businesses that was taken over by the floodwater. So now just think about the response that you would do. 4,000 people were displaced. The roads and businesses were closed. So when you're thinking about supplies coming in and out, and you're thinking about trying to get people in and out, those roads and businesses are closed, and there's 4,000 people. Okay, so as the only medical clinic in Plymouth, they were able to provide services. They had emergency first aid. They offered a temporary shelter site, which happened to be the fairgrounds in the next county over, which is great. But remember, many of the farm workers may not have private transportation, so that may have posed an issue. They provided water, baby formula, and then they had a healthcare services mobile unit RV or a bus. And that provided care for the community while they underwent a remodel because they were also heavily damaged. So that mobile bus unit was set up through about 3 weeks in. They had a provider and an MA that provided medical assistance. They worked with their local nonprofit partners, and they set up at the community center, whether it was windy or rainy, and they quickly mobilized to provide resources and donations from other clinics, such as hand sanitizer, food, basic household supplies to residents, and water. Now, I just want to take a moment there. So even though they were able to provide resources and donations, remember, when you have volunteers and when you're going to be receiving donations, all of that needs to be organized as best as possible, because if it's not, you're just going to have trucks coming in with donations. Where are they going to be put? Who's going to be in charge of all that? So all of that should be in your plan ahead of time. Okay, where are you going to get your volunteers, especially if they're going to be dealing with patient information? Okay. So clinical staff and nursing teams, they set up the tables and they offered basic medical care and services. So they were closed, but they had a couple of sister sites in nearby towns that they were referring the patients to. And if the patients had transportation, they were able to go there. And then also they set up a call center to help with prescription refills. Okay, because like I said, if you get evacuated and you don't have extra medication in your bag, or if you're not able to get your bottle or whatever it is, you need to have a way to get that prescription. Okay, get those refills fast. They used alert media as their mass communication system, which sent information and text to staff and patients. And then staff volunteers went door to door passing out flyers. Now that can be considered like part of a contingency or emergency plan, because passing out flyers door to door, like that may not be the fastest way to get information out, but it works. And also for alert media, I am not familiar, but I do work with another mass communication platform. We call them Titan, and it works great. We are able to send with just one click. We're able to send to all of our staff members, even some of our members, like, are you okay? This is what's going on. Are you okay? Just let us know. It has geofencing. We're able to see where they are. And if they respond to us that they are not okay, now we know where they are. Now we know if we can send services, send help. So those mass communication platforms, even though they are costly, I believe they're very worth it. Of course, there's other solutions, such as we've seen WhatsApp. So the state might not approve of it, but you can still use WhatsApp. And I know a lot of the farm worker population, they use that. Okay. And they use social media and also the medical app called MyChart. Okay, and MyChart's a great way to send out information, but there was a challenge. It was hard to get people to sign up. And even though MyChart is translated in Spanish, not every page was translated either properly or translated at all. So There's still a lot of work to do on that part. Next slide. Okay, and so this is an example. So I sat down with our Imperial County Public Health Department. I sat down with someone who was their farm worker outreach worker. Okay, and so just so you know, so Imperial County is right on the border with Mexico. They have a lot of people that cross the border daily to come work in the fields. Or they live on the other side, they come work over here, or they have family members. So when I interviewed them, because I wanted to get an idea of how they worked with them, this is what they told me. So he reiterated, you have to find where they live and work and gather. Okay, that's very important. That's one of the first things that they did. So we take services to them. So I was told that they go to the apartment complexes, they go to the housing units, and sometimes they even have to go straight into the field to either give out flyers or just talk to them. And then for us in California, we have Cal Jobs and America's Job Center of California. So you might have similar programs in your state, and those are great resources because the farm workers, that's where they go to apply for jobs, but they can also receive services and information. So like I said, many of the younger workers are more tech savvy and they use their mobile device, especially the app WhatsApp. Okay, that is their go-to. It is a good solution because it is free for mass communication. And I was told that they use it, especially if it's a 2 to 4 foremen for every 15 workers. And then I wanted to highlight here. So every year they have this annual Imperial County Farm Worker Appreciation Breakfast. So it is hosted by our state's EDD department or Employment Development Department. So it just shows appreciation for their hard work and contributions. They serve more than 3,000 people from 1 a.m. to 5 a.m. because many of them have to start work at 5:30 or even earlier to beat the heat. So I'm told that that is something great that they put on and people really appreciate that. Okay, and next slide. Identifying and developing partnerships with your community-based organizations. This will help you better respond. So community-based organizations, or CBOs, they are an underutilized resource. Traditionally, they don't have a special commitment. They're able to locate and reach those special populations. So find them, reach out to them. They can quickly communicate, mobilize the community and local resources in those situations. Integrating CBOs, and I put on here NGOs, so that's non-governmental organizations such as disaster relief. Put those in your emergency plan so they can help support first aid, health education, mental care, and mobile care following a disaster. Make sure to address the medical communication and transportation needs that are a priority. And for example, like we have used disaster relief. Unfortunately, we had a health center that was burned down. I was able to call disaster relief, and less than 12 hours later, I received a response of, what do you need? Let us know. We are going to send whatever you need. So, really have them in your plan, and all those others. I put Red Cross, and if you have a local, we call them CERT teams, the community emergency response teams. So those are volunteer groups. Next slide. Oh, okay, so now I'm these are some resources that I use, ready.gov. That is a great a site to go to, and it's also called Listo in Spanish. You can get a lot of checklists, a lot of guidelines, and they have a lot of information, especially for social media. Like if you want to put on your own campaign at your health center for your outreach programs, they have everything ready to go. Images, everything. And then, of course, for FEMA, this is a live link for the planning guides. Information about disasters and emergency management at your location. Click on that link. All you have to do is put in your zip code, and it'll let you know, like, what are the hazards around you. More than likely, the county and the state has already compiled that information, and now you know. And also I put in a template for developing and maintaining emergency operations plan. So that's, you can start and you can build or upgrade your own EOP. And then of course for OSHA is actually a really good resource. They have a whole site on agricultural operations. And then this other link is for agricultural, it's a safety fact sheet, specifically for emergency preparedness for farm workers. Okay, next slide. Oh,
And I'm jumping in here. Thank you so much, Candy. We wanted to share some additional NCFH emergency preparedness resources. So since we really focus on farm worker populations, you hit on one of the biggest main points, right? A communication plan. Now, we have known now that the demographic of farm workers has actually diversified quite a bit. It's not necessarily just individuals who speak Spanish anymore. There's individuals that speak indigenous languages. There's individuals from Haiti, so they speak Haitian Creole. So we have different resources available in English and Spanish. And then we also, depending on the topic, have other indigenous languages and Haitian Creole, especially for COVID or vaccine information. That's one of the biggest areas that we've focused on recently. So we wanted to make sure to share that with you today so that you have ways that you can develop these communication plans and also develop strategies for how to work with farm worker populations who have specific conditions of concern. And so one of the documents and resources that we have here is a emergency management for chronic conditions. So diabetes management for specific agricultural workers. So as Candy mentioned, these resources will all be hyperlinked in the slides. So you will be able to access all of them and have this information once we provide it following today's webinar. Now, the newest emergency preparedness response guide we just developed at NCFH is this new resources, and it hits on the 3 steps, that you really touched on, Candy, today. One being identifying and locating your farm worker populations. This is kind of the key, and you touched on this earlier because it really comes down to relationship building. What type of relationship do you have as an organization with your patient populations? Do you know where they are, where they live, how they gather? Those were some of the things that you mentioned during your presentation, and that is key. Farm workers really are prone to be able to go to individuals that they trust, that they have rapport with. And so do you know who your populations are? Knowing their needs, their language, their location, that is going to be the first step that you need to be able to incorporate them into your emergency preparedness plans and the way that you respond when an emergency hits. Now, Candy also touched on the communication strategy. So we shared a number of resources, but when you start to look at communications, what are those channels that farm workers really gravitate to? Is it radio stations? Is it social media? Is it WhatsApp? We also have seen very success in utilizing that virtual platform to be able to not only share information, but to share health education with patients as well. Because migratory farm workers are very mobile, right? They move around to different locations following the work. And so you need to be able to have a contact of some sorts, and WhatsApp is a very useful method for that. Now, last but not least, the collaboration with community partners. Now, as much as we would love to be kind of the one-stop shop for a farm worker, sometimes as health centers, you may not necessarily have a resource or be able to provide or mitigate a need like transportation. We have some health centers that have mobile units. You may or may not have that. So how can you build those relationships? Again, relationship building with different partners that can contribute to your efforts and be a part of your plan. Are they someone that you can work with to address transportation? Are they someone you can work with that can help you create kits? Sometimes even other community-based organizations or non-governmental organizations, they're always willing to figure out a way to provide some sort of donation or sponsor an event. you know, like the ones that Candy already suggested. If you have an event within the community itself, that gives you a great opportunity to establish those relationships. So then that patient, especially farm workers, they can go to you and they already know that you're someone that can provide resources and that can provide assistance. So we always look to ways to be able to partner with different organizations that can move your efforts forward and be able to provide resources and working together to mitigate an emergency response. One resource here that I have that we always really plug with all of our farm worker communities is our Call for Health program. Now, the Call for Health program is a helpline that we have bilingual specialists available that can help farm workers connect with their nearest community health center. And so we encourage you to share this number. We also have different swag, so to speak, available. So if you request, we have key tags, we have posters, we have flyers for you to share about this resource. So definitely go to our website to be able to request that information. And be able to connect farm workers to different organizations that can provide healthcare, that can provide social services, and most of all, emergency assistance in situations where disasters happen. Now, a couple other resources that we also wanted to plug here is the Disaster Distress Helpline, which is available. And you can, you know, either call or text or even go online to chat with someone. Because as Candy gave that example, right, if you're a farm worker that loses everything in that situation with the flood, imagine the mental toll that that takes on you. And we already know that there is a connection between mental health and physical health. So we always want to be able to provide some sort of outlet where farm workers can actually access support for their mental needs as well as their physical needs. There's also a preparedness calendar. So along with the checklist that you guys will be able to create from today's content, you can also even go to this calendar and just download it and have steps that you can do every month to remain prepared and kind of maintain those plans current. Because that's the other thing. Once you create a plan, you want to be able to maintain it, update it, reevaluate, and see what it is that has changed over a given time frame and things that you might be able to, you might need to update depending on how the circumstances may vary from that original plan that you drafted. So with that, I think, Candy, that concludes our presentation today. So we have Candy's information here and my information, as well as the lead for NCFH and emergency preparedness efforts here. So we encourage you to reach out to us with any specific questions you might have. If you're in need of any resources or additional information, we're more than happy to be able to provide that support. But with that, we thank you for being present today. And for those sticking around for the Q&A and the raffle, this now concludes our recording, and we'll transition to that in just a second.